My name's Sandra Morton, and I'm a specialist cancer nurse, helping cancer patients deal with their diagnosis and treatment. I'd like to tell you about the type of work I do, and particularly about one of my patients, recently diagnosed with prostate cancer. Let's call him Harry, to illustrate the sort of things I get involved with. Now, before we get on to Harry, I'll give you a bit of background. Clearly, my job covers many aspects of patient care, but what's the priority? Firstly, prostate cancer is in fact the most common cancer in men in the UK, with over 40,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So, if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating. Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective. So, let me tell you a bit more about my patient Harry. Like many middle-aged men, Harry was offered a routine health check at his local doctor's surgery. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. But he promised his family he'd look after himself. His wife had died of ovarian cancer some years before, so he felt obliged to go. It was during his appointment that, based on a few symptoms he mentions, perfect. So how did you find that? You'll notice that there was a lot of speaking.